Hello everyone, my name is Mridhula and I'm from Chennai. I'm a counselling psychologist. So my foundation's name is Aruvadai Psychological Support Services from Chennai, and it's been wonderful to have had a talk with Piyush on the topic of teen and depression, and it was very important for me to talk about how as people, how as family, how as friends we can support the teen who might be going through a depression.
Let's just not start with the question directly. Explain depression in your words. How to define it.
Okay, if you ask a clinical definition, it is something very different that gives you the time period, the duration of these symptoms to be felt and experienced by a potential individual for a little while. If you ask me in my words, depression is a low mood, constant period of low mood coupled with lack of motivation for an individual to even do the basic needs, to even meet the basic needs. Let's just say you want to go eat, you want to get out of the bed to take a bath. It becomes very difficult for the people to even get out of the bed and meet the basic needs. Okay, that's when you call it depression. Yeah?
Yeah,
And
I can.
this is something it should be persistent for about more than 6 months. Okay, if it's only lasting between 6 months to a year, we can clinically call it depression. Okay,
Have you ever faced something like that?
yeah, I have several times. Yes.
When was the first time you felt like I am in depression?
Mm, the very first time goes back to my childhood days. Obviously, 10 years ago, we weren't that equipped with knowledge related to mental health. So it was obviously unseen, it went unseen. But when I have to recall, now that you're asking me this question, it was during my childhood when we had some, familial problems happening. There was this constant period of low mood and lack of motivation. And when people were expecting state ranks from me, I just couldn't give a damn about taking my book and studying. I knew that there was an exam next day, but all that I could do was just sleep. Just go home, sleep. Just go home, sleep. That was all it, especially during the 11th and 12th grades.
I'm in 11th, right?
Oh, my empathies and sympathies to all the teenagers out there.
So, what are the common causes of depression?
Okay. See, common causes here again. I would go with first one, the biological reasons. The biological reasons is when we have certain number of hormones. Okay, so the secretion and the production of these hormones jinx up in the head, and it leads us to have experience depression. Number one. Number two, chronic stress. When you are going through chronic stressful environment or stressful situations in life, that again the release of cortisol keeps you in battlefield all the time. Just imagine you fight every day with daily hassles. There's going to be a day when you will be like, no, I just don't want to do anything at all. Okay, the constant pressure that you face will lead you to feel depressed. That okay, let me not do anything about it. Okay, that is number two, constant stressful situations. And thirdly, unpleasant experiences, unpleasant environments that you are in, unfavorable conditions basically. And when your basic needs are not being met. So these are times when you can develop the onset of depression can be seen prominently. Loss of a loved one is a very important factor for experiencing depression. It is found in grief. Like let's say the entire process is grief, but what also the person goes through is depression at the end of the bereavement period. Okay, so these are some of the causes we get into depression, and being in an emotionally abusive relationships, uh, just being not
Which
there in a healthy.
mostly teenagers have.
Yeah, mostly. Very sorry for you all, and we are here to help. I want them to know that just look out for the signs. What is a red flag for you? What is a green flag for you? Just see that. See that and prevent yourself.
Yeah. So, Next question we have is how does depression differ from uh, normal sadness?
That's an interesting question. So, I guess everybody are using these mental health terms nowadays in a very shaming way. Okay,
Yeah,
oh, you're this depressed person, you are a psycho, you are this, you are that, you have bipolar. We've started using these terminologies. We've normalized these terminologies, and we also fear our emotions to be felt or our emotions to be acknowledged. You go tell somebody that, hey, are you feeling sad? Just like that, you want to offer help to them. They'll be, no, 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 I'm fine, I'm all good, I'm good. No, 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 nothing like that.
yeah,
We fear our emotions being acknowledged. Okay, so just like how happiness is, you need to experience all the emotions. All the emotions are normal, you have to be feeling them all. Having said that, the minute you find yourself feeling sad about something, you think that something is wrong with you. Come on, we can't be on that elation peak forever. We can never be there. It is
yeah,
supposed to be a roller coaster. Let it be a roller coaster with acknowledgement. Okay, so see, that's where it starts from. The differences between sadness and depression. Even when you feel a valid, legible sadness, you think that it is depression. Okay, I want people to come out from that firstly, from that mentality. So number one, you can feel sad. Number two, you don't have to feel sad for a longer period of time. Okay, given this.
depression is not only about sadness.
Yeah, it's definitely not about sadness. Like I said, lack of motivation is another key thing. To even to get up and brush your teeth, you are
Yeah,
being hit there. That is how depression feels like. It's not 1 day, 2 day scenario. Let's just say if Argentina lost last night, we all wouldn't have been sad about it. Probably for a week we would have been bummed about it. That is normal. That is very normal for us to feel
yeah,
that way. But if you are holding on to Argentina's loss, they won, yes. But if we are holding on to that for more than 3 months, 6 months, you couldn't get over it. That's when it becomes depression. Okay, and depression is not just sadness; it comes with other symptoms as well. Like I talked about, excessive sleep or reduced sleep. Either this person is going to sleep more. Sleep is going to be the go-to. Okay, let me just hit the bed immediately. Minor inconveniences happens. I'm going to sleep. Overeating or undereating. Oversleeping or undersleeping. Okay, all of these things to be looked out. And when you find yourself feeling sadness or excessively sad, you are going to refrain from your normal day-to-day activities. Let's just say we are all having a routine. You're going to derail from that routine. Let's just say you are going to meet your friend every week, but constantly you cancel on your friends. You give no reasons, you just cancel on your friends, or simply you just want to be at home. You just don't want to go out and talk to them. Be it you talk about your problems or not, you're just not ready to face them.
yeah.
Constantly you keep doing this. This is another indicator where we can find this person having depression.
Okay, this is my personal question.
Please.
Do you think like feeling irritated can be a part of it?
Yes, definitely. Because most of the times, what happens is people don't understand why they are feeling this low, and irritation becomes one coping mechanism. I just don't know why this is happening. Oh my god, it's all messed up now. They just don't know. And irritation is a very less factor that you can see, but it can be seen too.
Can meditation alone treat depression, or is therapy also necessary?
Okay, first of all, meditation is the most difficult thing for a person to do when they are going through depression.
Yeah,
Because meditation involves that oneness, bringing that oneness within yourself. When you don't even have an energy to lift yourself up, bringing that oneness in your conscious is the most difficult thing. So, if somebody had prescribed meditation as a go to tool for depression, let me tell you, it's not a tool for everyone. Probably
yeah.
it worked for one or two, but it is not the go to tool for depression. Number one. Okay, what we can do is we can start with some calming procedures. Okay, and secondly, if the depression is severe and for a longer period of time, that it had affected the hormonal secretion, it affected your biology completely, in that case, you will definitely need a visit to the doctor, who's a psychiatrist. You will be needing medications in that cases, and you should be stopping those medications only under the prescription. The doctor must tell you when to start. The doctor must tell you when to stop. You, we don't have to stop and start at our ease. Okay, number two. Number three, definitely psychotherapy helps in dealing with depression because people want to feel heard and seen. People want to cry out. So therapy creates a place where you can be heard and seen and be yourself, and we can piece together the causes of these depression and how it is affecting you. If we cannot do much about the causes, let's just say I'm feeling depressed because I lost my mom last year and it's still with me. It's grief followed by depression, yes. So this is something unchangeable. You can't go bring my mom back for me to relieve from my depression. So here we can help the clients with strategies to how to cope dealing with this grief followed by depression or any kinds of depression for that matter. Okay, psychotherapy definitely helps in modifying your thoughts, your behaviors about your condition. Okay, that helps you improve your mental health altogether.
Why do you think like most of the teens or even adults feel ashamed to go to therapy? Like
Ah,
some,
we've shamed it enough for the people, right? All the movies that we've seen in the 80s and 90s have only portrayed mental health as something, something to be caged. If you talk
yeah,
about your problem, you will be caged, you will be quarantined, you're going to be treated differently. Who would like to be isolated when they are dealing with something sad, something that nobody can even understand? Okay, we have taken that perceptions very seriously and identified that, oh my god, mental health is something serious. If you identify somebody who is going through, let's just say, who's tested positive on HIV, he is doing fabulous than when compared to a person who's going through mental health illnesses because of the awareness. People know that HIV can be transmitted in several other ways. HIV has the same stigma as much as mental health is going through right now.
yeah,
Awareness is needed for people that it's okay if your leg is broken, you go fix it with the doctor. You're not ashamed of wearing the band-aid and taking support for the next 6 months from someone. You just don't feel ashamed to do that. But when it comes to your mind, which you can't see it for yourself, you're scared. And people have scared apparently. I'm very sorry that this has happened in our society. It was when you say the word mental itself is shamed highest. Okay, yeah, this person is definitely lost. This person has severe illness. We related to all the mental retardation cases, all the cases where the severity and intensity is only correlated. So that's the reason.
as society really needs.
Awareness, yes. Please, as being youth of India, take it forward. Spread the awareness that it's okay to go see a therapist. It's okay to talk about your problems.
So, how can friends and family support someone with depression?
Okay. The first role of friends and family would be to helping the person giving that person space to even come out and tell you that I am dealing with something. So what happens is when we find our family member, let's say the teenager who's going through some sadness, we create stories about the same. You go and ask them, oh, did you fail this exam? Did this teacher tell you this? Did this girl dump you? Did this happen? Did that happen? We go with questions. Rather than doing
Yeah,
that, just open up the space. Is there anything you want me to know? Is there anything I could help you with? Probably at least 1 out of 100 will open up telling you that yes, there's something bothering. Probably I've
yeah,
seen some upsetting things. Things have been very upsetting for the long while now. I lost this match. I couldn't deal with it. I think that I'm incapable. Let this person open up. So start with an open question. Number one. Number two, don't bombard them with support. You can show your care in a very gentler ways. You don't have to. So sometimes what happens is when I have teenagers visiting my clinic, the parents wouldn't have told the teenagers that they are visiting a psychologist, and the kid here will be super angry and annoyed at the parents that why are you treating me like this? You could have simply told me the truth. The parents intention was to care for the child. seek the best professionals' help. All of that is the best intention of the kid, yes. But we mess up thinking that, oh my God, they are going to judge and this is going to happen. So involve, have them in discussion. Ask them, do you think there's something you need with this? Can I help you with the professional over here? It is okay to talk about it. It is okay if you don't want to tell mummy about it. If you want to talk about it to someone else, it's totally fine. Give them
Yeah.
that space. Don't just crush them with, your advices. Oh my God, the unsolicited advices. Keep your phone away. All your problems will be okay. I'm done. I am done this. Having all the teenagers talk about it.
Yes, yes,
Let's not give any unsolicited advices when we find somebody being emotionally charged. Be it anger, be it sadness, be it happiness, no unsolicited advices. Let them learn it at their pace. The best we can do is guide and support.
yes. So, like, you have seen many things like with
Mm-hmm.
your
Mm-hmm.
family.
Mm-hmm.
So, like, what are the common problems that you have noticed that they are facing?
I would say friendship issues. Firstly, to begin with, friendship issues. Teens nowadays are struggling to make friendships and maintain friendships.
Yeah,
Okay, so when that it is a primary part. Friendships becomes an integral part when we are in our adolescence, because the feeling of belongingness and somebody who you could relate to.
yeah,
By the time they are adolescents, our parents are somebody in between a villain and a hero. They try to tell us nice things,
mm,
but in a very unacceptable ways. So we find that irritation, like do one thing. That's the feeling we will have. So we need that relatable sense with our fellow humans. Okay, so our fellow
human being.
humans. Absolutely. So friendships becomes a very integral part. So when we struggle in that friendship, kids tend to feel that okay, I am no good, I am this, I am that. We attach a lot of labels about the same, and there starts our feelings of depression. And secondly, this is very unpopular, people don't talk about it mostly, the relationships. Nowadays we want to think that nothing of that sort happens with children, but it does happen. We all
It
tend
does
to have
happen.
our first loves in our adolescence, which is normal, which is natural. And they
Yeah,
only need help with dealing with the failure of it. Because sorry to say, 99% that's what happens in the for the adolescent life.
yeah.
Yeah, so they need support to talk about it in a very healthy way. So these are common problems. And thirdly becomes the academic pressure. So the child being crushed by the school as well as the parents. So the child isn't having a vent space where they can talk about, no, this is not what I want to do. So they don't get that space to say, this is not my favorite subject. I'm not having an option to switch schools. I just have to deal with this horrible person for the next 3 years of my schooling. So all of these problems come under the third category.
So if you get a chance to put one thought, any idea in the mind of our parents, what would it be?
I would like our parents to be more intently listening to the children. Listen. I think our parents, I guess in all the generations, parents think that we have a lot to tell the kids about how to perfectionize your life. Do this, you will be better. Do this, you will be great, greater, greatest. We have a lot to tell them, but we never listen to them. Almost never listen to them. I think that a simplest solution of listening to the teenagers will start the revolution. I'll tell you a personal example. My mum was very revolutionary. So I come from a so-called dysfunctional family. My father was an alcoholic. He is dealing with his life himself, dealing with alcoholism and everything. We are there to support him come out of alcoholism and everything. But childhood was very terrible. Childhood was very terrible. Given adolescent reasons when being in a co-education school, too many things was happening. Academic pressure, peer pressures, familial problems, too many things was happening. My mother was being the breadwinner of the family, and I just awe at her. How was she able to do that? She was visionary back then. All that she made sure to do was to listen to me rant. I'm sure I wouldn't have made any sense about anything that I spoke back then, but she made sure she listened without any judgment. So, what it gave to my mind, what impression it gave to my mind as a child is, if there's anything, I can go to mom.
Yeah.
I didn't have to search or look out for somebody else outside of the family in the first place. She gave me the space to talk about it, to talk about menstruation, to talk about liking a guy, to talk about, the exams being truly stupid. So I was given that. You know what she said? It's okay, you feel that way. Academia doesn't have to be everybody's cup of tea. What is it that you'd like to do? So I
Yeah.
had somebody who could listen to me. And from there, she took me to a professional. I did go for counseling when I was in my 10th grade. So I met the therapist, and that's how the idea of, wow, psychology, yes, let me get into it, happened for me. So it was a life changing thing. She only listened. She was not great at advices. She does offer advices, but I don't remember any of it.
So, how does depression affect a person's daily life and relationship?
Okay, with daily life, like I already talked about it,
Yeah.
the lack of motivation isn't just going to give you the enough kick you needed to start the day and maintain the day. So you are going to fall out of your routine and schedules. You will have hard time in meeting the expectations, which are very normal. Number one. Number two, when we talk about relationships, this person has really low energy to even talk to you about what they are going through. So you refrain yourself from socializing. So that leaves a lot of gap between your parents, between your friends. That makes it very hard for the other people to reach out to even offer help for you. So that just builds up. The gap being built up becomes very corrosive to the relationships. Yes?
So, yeah. So, can someone who has experienced depression expected to have it again in the future, or is it a one-time thing?
No, no, you can have, because unless and until you unlearn the patterns of depression and the relearn better, effective coping mechanisms, we can expect a relapse. So it happens in intervals of years. You can do fair amount of years without having a relapse, provided you have learned healthier coping strategy. Let's just say I have been going through depression and I've been over it with the help of therapy and medication and everything. I've been doing fair enough in my life for the next 5 years. Let's just say I'm having loss of a job or loss of a loved one or a breakup. So these are several other factors that can kick in the unlearned patterns again in life. Okay. So you need to be wise enough to identify the indicators and prevent yourself beforehand.
So, how can we create a more supportive and an understanding society for those living with depression?
Like I said again, no unsolicited advices.
Hmm.
2 years to listen. So probably if we are just there to listen, be it silence is the only thing they have to offer us, let's listen there. So that gives them that safe and secured feeling that okay, I can talk about it someday. So that itself is a first step of victory, I would say. So that is how we can show up more kinder and gentler ways, and looking out for the indicators when you see the warning signs, helping the person, motivating the person to seek for professional help. Let's just say you have your bunch of friends and you find this one person who is going through depression constantly, and you can help him. You can tell him that try this, being a constant reinforcer so that this person gets the right kind of help. Yeah, these are some of the things, littlest of things that we can do.
Yeah. So, what resources are available for individuals seeking help for depression?
Resources as in.
Like for therapy,
Mhm.
and
Okay.
because most of the teenagers don't know how to reach there.
See, there are a lot of support groups available. Okay, I think the search should be more wiser with words. So there are a lot of support groups available for people with depression. So that's one thing you can do. And the second thing that you can do is reach out for pro bono options. So in fact, even in our company, we offer pro bono sessions because we have a lot of students coming in for counseling under pro bono sessions because they can't afford real time therapy, and Some other reasons would be they don't want to freak their parents out by saying that they have mental illness, mental health issues. So there are a lot of people who does work like this. Okay, so you can look out for that, number one. And there's always self-help. All the, if you see all the mental health related handles on Instagram or YouTube and any social media platform you think, they give you a lot of self-help methods. So it just takes that first step of you to try out some of these self-help method measures for you to make yourself feel better. Yeah, so that is something you can start with. And when you ask me, in specific to therapy, we use very promising approaches like cognitive behavior therapy, wherein we help clients learn a particular, remodify the existing thought patterns and behavior patterns and change it to a healthier mode so that you can effectively cope with it. There are art based methods and techniques that we can help any clients with. Yeah, so these are some of the resources that are out there for sure.
Would you like to explain what do you do?
Yes. So I'm based from Chennai. So we started off as a training company to begin with, and my company, we go to the field and do the work rather than expecting the clients or the walk-ins. So that's one of my dreams. So we started doing a lot of programs on safe and unsafe touches over about 1,000 schools here in Chennai. All the schools were underprivileged background and from government aided and government schools because that's where it was needed most. And number one, and number two, we then developed our wing for counseling, and we started doing individual counseling and group counseling need based programs. And recently we have launched a couple of important close to heart projects. Number one is listening buddy, wherein we have a helpline number. The service name is listening buddy. People can call to this toll free number. It's a toll free number. And once you call this, there's a trained psychologist who are trained in psychological first aid who picks this call and offers that emotional support for anybody who is in need. That is number one. And number two, we also offer pro bono sessions wherein it's pay as you wish or a free counseling session for about 3 to 4 sessions per person. Because beyond which it needs a little bit more serious of therapeutic work and an informed care. So we stretch about 3 to 4 sessions of help for free of cost. So these are a couple of things we've come up in the last 6 months, and it's been going really great.
I really appreciate it. Thank you for
Thank you.
joining.
Thank you so much for
That's
initiating.